While tonsil stones may seem like a bad medical hoax, they can be a real problem. Tonsil stones, also known as tonsilloliths or tonsilliths, are benign accumulations of bacteria and debris in the crypts of some people's tonsils. Though this problem may cause discomfort, it is not dangerous and is usually easily treatable. Causes of tonsil stones. The tonsils are part of a protection system that keeps foreign objects from slipping into the lungs. They are also lymph nodes that filter for bacteria and viruses while producing white blood cells and antibodies, according to the Mayo Clinic. Objects such as food, dirt and other particles can get stuck in the grooves on the surface of the tonsils. The grooves, called crypts, also collect old cells and bacteria. According to Dr. Alan Green, a pediatrician and author, tonsil stones are most common in teens and those with large tonsils. Those with poor dental hygiene may also experience tonsil stones. Symptoms of tonsil stones. Some people have no symptoms when afflicted with tonsil stones. Those who do have symptoms often report redness or irritation of the tonsils. There are several other symptoms that can be related to tonsil stones, with bad breath being one of the most obvious. According to the Mayo Clinic, bacteria grow on the stones, which produces a foul odor. People with throat stones can also feel like they have something stuck in their throats, according to Dr. Eric P. Voigt, an associate professor of otolaryngology at NYU Langone Medical Center. Other symptoms can include chronic, mild sore throat and recurring tonsillitis. Tonsil stones can often be seen in the mirror. The tonsils won't seem smooth. Instead, they look like prunes, with crevices where bacteria can accumulate, said Chen Keir, a dentist in London. Typically, tonsil stones can be seen as white, yellow or gray nodes on the tonsils. This isn't always the case, though. Many tonsil stones aren't visible because they are burrowed down inside of the tonsil, said Dr. Eileen Showalter, an otolaryngologist at Mercy Medical Center in Baltimore, Maryland. Treatment for tonsil stones. One of most common treatments to cure tonsil stones is simply scraping them off with a toothbrush. If that doesn't work, there are several other at-home options. Gargling with salt water can help dislodge them. Using a cotton swab to express them from the little small cavities that are visible is another option, said Showalter. A water flossing device such as a water pick can also be used to power wash the debris out of the tonsils. According to Voigt, a last resort cure of this problem is tonsillectomy. However, this surgery carries risks of anesthesia, pain and bleeding, as well as other risks. Thus a decision of this type must be balanced by a risk-benefit discussion. Prevention of tonsil stones. Preventing the formation of tonsil stones is as simple as good dental hygiene. The Mayo Clinic suggests brushing teeth and tongue after meals, at bedtime and first thing in the morning. Flossing teeth daily can also help by cleaning out bacteria. Dr. Eric P. Voigt also suggested gargling daily suing commercial gargles, or a homemade solution of hydrogen peroxide and water. The Mayo